Who should not be getting the COVID vaccine? COVID-19 has wreaked havoc worldwide. Millions of people lost their lives. Thousands became unemployed. And let us not talk about the uncountable disruptions caused in our daily lives due to this global pandemic. In the midst of all of this turmoil, a ray of hope came in the form of COVID vaccine to combat the deadly virus. However, there are various speculations regarding the vaccine, especially about the people who should not get the COVID vaccine. Therefore, through this video, let us talk about some of the common queries that people have regarding the vaccine and hope that we can solve the most. Who should not get the vaccine? The vaccine can be given to people of all age groups, but there are certain exceptions. Number 1. People who have a history of severe allergic reactions. People who can suffer from severe forms of allergic reactions or anaphylaxis from any of the components of the vaccine should avoid taking the vaccine. People suffering from such conditions should consult their medical provider before they take the vaccine so that they can assess all the risks and possible outcomes. Apart from them, people who have allergic reactions to food, latex, oral medications, pets, insects, or some other environmental triggers can easily get vaccinated. Usually, people with severe allergic reactions undergo a 30-minute observation period where they are observed for any reactions, and usually the clinics and hospitals where the vaccination process takes place are well equipped with all the measures to respond to any adverse condition. Number 2. Women who are pregnant or breastfeeding. Research trials regarding pregnant women and COVID vaccines are limited as they were intentionally kept out from the process. However, from the limited studies and trials, it has been found that pregnant or breastfeeding women can be vaccinated, but it should be strictly under the guidance of medical advisors, as in these cases, more than one life is simultaneously involved. There have been no medical boards that have issued any warning regarding pregnant or breastfeeding women against vaccination. Pregnant women are more vulnerable to the severe illnesses caused by COVID-19, and therefore it makes it twice as important for them to be vaccinated. The side effects that are commonly observed in them are fever and body ache. For breastfeeding women, there is currently not much data regarding the safety of the vaccine. But in some trials, it has been found that robust antibodies are produced and through the breast milk are transferred to the breastfed infant. So it can be a win-win situation for both. Number 3. People who have been tested COVID positive. Clinical trials have suggested that people who once have been tested positive and have recovered from the condition can be vaccinated. The Centers for Disease Control and Prevention, or CDC, suggests that the affected person must be completely recovered from the condition and should fulfill all the criteria required for discontinuing isolation. There are also slight variations for people who have received antibody therapy for their recovery. It has been found that people who have undergone antibody therapy have antibodies present in their bloodstream that interfere with the immune responses stimulated by the vaccine. Therefore, the delay curve in these conditions is for over 90 days. After the stipulated time period, one is then eligible to get vaccinated. Number 4. People suffering from autoimmune disorders. Clinical trials suggest that people suffering from autoimmune ailments are eligible to get vaccinated only if they would not have contraindications to the vaccinations. People suffering from such diseases are at the highest risk to get infected with the COVID-19 virus. But CDC suggests that there is limited data for the safety of the COVID vaccine and people with autoimmune disorders. A few of the clinical trials of the vaccine with people suffering from autoimmune disorders have shown no imbalances unless contraindications to the vaccine developed. However, post-vaccination, safety surveillance is required to make sure the vaccinated people are safe and sound. Number 5. Children and adolescents. As of now, children and adolescents cannot take the vaccine as there have been no clinical trials to mark the safety of the vaccinations on them. However, the trials are expected to begin shortly. Till then, they should not take the vaccine. Who should stay away in short? No person below the age of 18, pregnant and lactating women, people having an anaphylactic or allergic reaction to any of the components of the COVID vaccine, people having active symptoms of the COVID-19 vaccine, people who have administered SARS-CoV-2 monoclonal antibodies or convalescent plasma treatment, people having acute illnesses and hospitalized for the same, people suffering from thrombocytopenia or low platelet count. Most of the groups mentioned above, except for children and adolescents, can get vaccinated, but extra precautions should be taken for them. These people are at a higher risk of getting infected by COVID-19 and they need to have a shield against the deadly virus. We would just like to conclude by saying that the last decision always lies with you. Consult with your medical advisor before you take any decision and weigh all the benefits, risks, and complications involved. That's all from us today. We want you to know that your voice is important to us. So please leave a comment below. If you are new here, then click the bell icon for notifications of our new videos and subscribe to our channel.